Today, we're breaking down the results of a prostate MRI scan in simple language so that anyone can understand what's going on. The prostate is a small gland about the size of a walnut that sits just below the bladder in men. It helps produce some of the fluid in semen. Doctors often scan the prostate if they're worried about cancer or other conditions. This scan showed an abnormal area on the right side of the prostate. It's about 3 centimeters long. That's roughly the length of your thumbnail. This area stretches almost across the whole gland, from the top to the bottom. When doctors say there's an abnormal signal, it simply means the scan picked up something unusual compared to normal healthy tissue. This doesn't prove cancer yet, it just raises suspicion. This right-sided abnormal area touches the outer edge of the prostate, known as the capsule. If this turns out to be cancer, the contact with the capsule means it would be considered stage T3A. In plain terms, that means the cancer might be starting to push up against the wall of the prostate, but hasn't spread to distant parts. There's also another smaller abnormal area, about 1 centimeter, on the left side, right where the prostate connects to the seminal vesicle. The seminal vesicles are small glands that sit behind the prostate and also make fluid for semen. If cancer is found here, it would likely be classed as stage T3B, which means it's not just pressing against the wall, but possibly spreading into the seminal vesicle. The prostate size was measured at about 52 milliliters, a little larger than average. When we compare this size with the PSA blood test level, we get something called PSA density. In this case, the PSA density is 0.06, which is actually on the lower side and somewhat reassuring. However, the suspicious areas scored a Likert 5. This is the highest score radiologists give on MRI when they think something is very likely to be cancer. Because MRI alone can't confirm cancer, the next step is a targeted biopsy. That means doctors will take small samples directly from these suspicious areas to check under the microscope. Only then can they say for sure if it's cancer and what type. So, in summary, the MRI shows 2 suspicious areas in the prostate, one on the right and one on the left, that need further testing. If cancer is confirmed, they would likely be classified as stage T3A on the right and stage T3B on the left. The important thing now is getting that biopsy, which will give the definite answer. Remember, MRI findings are just part of the picture. The biopsy and follow-up with your doctor are what really guide the next steps.